Welcome to Muted in Medicine, the podcast where we break the silence on the untold stories and pressing issues within the healthcare profession. Join us as we dive deep into topics that often linger in the shadows of medical corridors and are not discussed in conferences, meetings, social gatherings, and in the hallways. They are often hiding. From navigating errors and facing litigation to the often overlooked realm of mental health among healthcare professionals. Through candid conversations and storytelling, we aim to amplify the voices and shed light on challenges that resonate across the medical landscape. So grab your stethoscope and a cup of coffee and tune in as we uncover the layers of complexity in the world of healthcare that are so muted, yet so profoundly impactful. Hello, everyone, and welcome to another episode of Muted in Medicine podcast. My name is Saba Fatima, and I'll be your host for this podcast. I'm a pediatrician with a passion for helping healthcare professionals facing secondary trauma at work in healthcare, which often they're unprepared to face, and spreading more awareness about it. And with this podcast, we hope to discuss some of the most silenced topics in healthcare that are often not openly discussed. Stress is an inevitable part of life. But for healthcare professionals, chronic stress often becomes the norm. The constant demands, high stakes, physical and emotional toll of caring for others can leave us feeling often depleted and overwhelmed. But stress is more than just a feeling. It can have serious effects on both our physical and mental health, from disrupting sleep and immune function to impairing memory, focus, and emotional regulation. Chronic stress impacts every aspect of our well-being. In this episode, we dive into the pervasive issue of chronic stress in healthcare. What does it do to our bodies, our minds, and our ability to provide care? More importantly, how can we break this cycle? Today, we'll try to explore some practical strategies for managing stress. And to discuss this with us, we have Dr. Saba Wittry. Dr. Wittry is a hospice and palliative care physician, wife, and mom of 4. After navigating infertility, adoption, anxiety, and burnout as a physician mom, she's passionate about empowering other professional moms to reclaim their time, energy, and joy. Through her work with Vibrant Humans, Saba helps women redefine what it means to be a good mom and professional, set boundaries, and prioritize their values so they can live a more vibrant, balanced life. Saba, welcome to the show.
Thank you so much. I'm so happy to be with you here today.
So we ask everybody this question at the start of the podcast. What brings you joy in medicine today?
Ooh, that's a great question. I love it. I think that probably the biggest thing that consistently brings me joy is the connection that I have with patients on like a very human level, getting to know them outside of kind of their diagnoses, their illnesses, and just getting to know them, on a very human to human level. That's what I think brings me the most day-to-day joy.
Yeah, and most of our guests answer the same, the connection with the patients and talking to them is the most important thing. Yeah.
Mm-hmm.
So talking about stress, I guess we all know it because we all experience it every day, but I guess just to name it and write it down, what does stress look like in healthcare workers? And I often wonder, I go to Walmart or Target and I look at, people and I'm like, does the stress in our life compared to every other person in every other profession? Or my guess is it doesn't, but what do you think?
Yeah, no, I agree. I mean, I think our world overall is getting more stressed. But I do believe that as healthcare workers, we have an extra added burden compared to kind of the general public. I think that, there's so many different aspects of like the healthcare system that cause us a lot of stress. And then I also think that because most of us that go into medicine are pretty high achieving at baseline, it's just our personalities that we also tend to be We hold ourselves to very, very high standards. We want to be as flawless and perfect at things as we possibly can. And so as more and more demands are placed on us for, productivity and EMR and all of the things, serving on committees, adding research, teaching, just all the different things that come with medicine in today's world, like we want to do them well because we want to make others happy, right? And we also want to do them at the expense of our own well-being. So I think that, we have a huge amount of stress, and it's led to a lot of burnout and people leaving medicine and people, deciding either that they're going to stick it out, but they're like unhappy, or they like want something different altogether.
And even physically, right? Because I feel like this job is physically taxing and we know it from the get-go. You're supposed to take call, you're supposed to work weekend, no matter like what setup you're in, because some setups are worse than the others, like if you're critical care or ER or something like that. But still, you're still gonna take calls on weekends.
Yes, absolutely. And we don't get much I feel like training is notoriously bad, right? For like not taking care of ourselves at all.
Right.
But then even after that, it's like most of us have issues with something in our well-being physically, like whether it's sleep, poor sleep, not enough sleep, diet, nutrition, like finding time to do any kind of movement or social connection or like any of those things that are so important that we talk to our patients about, like we are often not able to find time to do for ourselves. So it's like kind of, just widespread. Stress takes a ton of toll on us. Yeah.
And what does stress do to the human body? Because I feel like when I have been going through training and everything, I just felt like, okay, this is just part of life. But then I'm getting older and I'm like, it is, I realize it's affecting me physically, it's affecting your mental health. So what is the effect of chronic stress on any person, any general human being out there?
Yeah. So I think, there's like the difference between acute stress, which we know is good for us. I mean, indeed, like it helps us get what we need to accomplish or like deal with the acute threat. But when we have kind of chronic, unrelenting stress, that we just come to experience as normal everyday stress for us, and we don't have ways that we've like processed through it and started to like cope and manage with it, then that chronic stress really can affect us from like head to toe physically, right? And it can create like overall elevated cortisol levels that are just like circulating in our system and causing like a lot of inflammation and contribute to a lot of the like chronic health conditions like high blood pressure, heart disease, increased risk of stroke, weakens our immune system, right, over time. So not only are we more prone to like respiratory infections, just kind of run of the mill infections, but also like autoimmune conditions and cancers and all of those things. And I think those are really, really huge physical things that we've become sort of unaware of because we're just kind of plugging through and, putting our heads down and kind of saying, this is normal. And this is just what it is to be a doctor, work in medicine, but like, it's like physically and then mentally it affects our mental health. And I think also like our emotional health as well is all of those aspects of us as humans are really chronic stress can be quite detrimental to.
Yeah. And at some point, I mean, I think your body tells you, right? Like the body will start giving you some sort of signal.
Absolutely.
Which happened to me.
Absolutely.
Yeah. Which happened to me because I think I've lived a whole stress life and then I got diagnosed with an autoimmune disease and I just started, thinking back and looking at my life and I'm like, nobody has it in my family, like no one. So where did this come from?
Yeah.
Yeah.
Totally.
And I'm not an expert, but the only explanation I could think of was, this years of like chronic stress and bad sleep and everything bad, so could contribute to it. But it's so discouraged to feel, we feel so guilty when we experience any sort of stress, which also, I mean, I don't know if you share your story, but I feel like we feel so guilty. We see it as a sign of weakness. And what's your story with stress too?
Yeah.
And do you agree with that?
Absolutely. Absolutely. I think it's very, very common belief for people in medicine to believe that like if you are experiencing stress or, frequent feeling of overwhelm and just like, I don't know if I can keep doing this, right? It's like you kind of
Right.
have this belief, at least I did, that you're the only one that like can't cut it. Um, and yeah, for my own story, I think began pretty early, like in residency training, where I just had this awareness that my mind, my body were not doing well, right? I had like a lot of headaches and migraines and like a lot of like tension and pains and aches and stuff. Like I had like arthritis, I felt like, or just like a
Yeah.
ton of muscle aches and yeah, I was sleeping poorly. Just like my relationships were not good. I felt like I didn't have any time to put into them that I wanted to. And being like, recently married and just like I had this sense pretty early that like this is not how I want my life to be. But I also at the same time was struggling because it was like, well, I've put a lot of years into this, right? And I need to be strong and push through and like not complain. Because otherwise people are gonna think like I'm not cut out for this. I'm not a good doctor. And so, and I felt like even when I was kind of vulnerable and barely talking about it to others, like my colleagues and such, like they were like, yeah, kind of, or whatever. They agree, but like kind of get over it, right? Like you're gonna have
Yeah.
to suck it up and do it. Um,
Yeah.
and so yeah, I feel like everyone's kind of on their own journey of awareness in terms of like
Yeah.
what the chronic stress does to them and how the culture of medicine does not place much emphasis at all on us like noticing that for ourselves or kind of making small changes or pivots so that we can better take care of ourselves. And a lot of it is like unfortunately more of like inside job in terms of
Yeah.
figuring out what is and isn't acceptable to you and like the big picture of life. You know what I mean?
Yeah, that makes sense. And I think it's changed over time, though,
Hmm.
a lot of,
Hmm.
yeah, I'll be excited to see what the next generation, but, with the Gen Z and younger people, they
Yeah.
are more, and it's great. I think it's great. They're more
Hmm.
vocal about their boundaries and, they know what they want.
Hmm.
And, um,
Hmm.
but I
Totally.
still think there's a long way to go in changing the medical training, the medical training culture,
Yes.
even the work as an attending or as an independent provider. A lot of the things are still the same, right?
Absolutely. Yep. Yep. The culture takes longer to change, right?
Yeah. So I still think the people may be changing a little bit, like the systems are
Hmm.
still kind of staying the same. What do you think about work-life balance, and how do you maintain that in your life?
Yeah, that's a hard question. I think for me, I found that it's like when I look at it as something that's always evolving and changing, that helps me. Because, what feels good and sustainable for me it does change like with different life circumstances. So I think that's really important for me and for everyone to kind of know is that I define it as, something that's like the way that you spend your time feeling really good, like you are not feeling resentful of the hours you're at work and you feel like you have, you know, time in your day to be with your people and to take care of yourself and like engage in activities that are enjoyable to you and kind of help you fill back up or get replenished. And so if you are feeling not that way, sometimes of course there's going to be situations or days that are kind of like, they're just hard. But then if you're feeling that way more often than not, I feel like that's when you kind of know it's like a red flag for you that you're out of balance and that there needs to be some tweaks or some changes to help you feel more like yourself, right? And that you're able to
Yeah.
not just kind of like make it through, but like enjoy what you're doing and overall feel that sense of like fulfillment and purpose, and joy in your life. And for me, that's looked a lot of different ways, but I've cut back clinically, like my FTE time, and that helped a lot. I really value freedom. And so having just a little bit more white space in my life has made a lot of difference for me. And then really being like consistently prioritizing, the things that I know I love and that I enjoy and that like help me feel like a more balanced, whole human.
Yeah.
Helped me a lot to be like a good wife, a good mom, at least show up in the way that I want to show up, not like they're getting kind of like the extras or the last little bits of me. You know what I mean? And yeah, I just think
Mhm.
it's hard because you can like kind of know the boundaries you want to set or the way you want to spend your time, but then actually like implementing that, is really, I would say, emotionally uncomfortable for us because we are conditioned to be, people that want to please others and don't want to come
Right.
across as like too self-centered. And we have a lot of like worry about what others think about us. And so I think that's, a process that I've needed my own support, coaching, therapy, all those type of things to be able to say, really get clear on like, these are the things I want and that I care about. And then how do I make them actually happen?
Yeah.
You know what I mean? Without so much guilt and doubt. Yes.
Yeah. No, that makes total sense. I think it's a process really to get there, though,
Mm-hmm.
because
Mm-hmm.
I agree. Sometimes it's hard for us to say no, and then also, even when you're trying to strike that work-life balance, there's so much guilt and shame, even of
Mm-hmm.
not being, like you said, a good mom, wife, daughter, friend,
Mm-hmm. Yeah,
or son,
totally.
anything that you want to be. So to fit in all those roles,
Totally.
I think we gotta say it out loud that it's not really possible to be 100% in every
No,
sphere. So to accept the imperfections, I think maybe the first
exactly.
step, right?
Exactly. And except
Yeah,
like one coach that really helped me a lot was really just get clear on like my capacity as a human being. Like the way
yeah,
that most, I'd say, doctors operate, right? Is like over capacity at almost all times. And then they're stressed and they're overwhelmed and they're like, why? What can I change? What can I do? And it's like, well, when you keep expecting yourself to like do this amount of work in this amount of time, like you're setting yourself up for failure, right? Because not to be like negative about it, but it's true. It helps you have a little bit more understanding and compassion toward yourself because it's like what you're asking
yeah.
yourself to do day after day, like no human
Mhm.
has the capacity to do that, right? So it's almost like, oh, it makes so much sense that you feel overwhelmed or like you can't possibly,
Yeah,
maintain that level of functioning because it's like it's too much for a person to take on and continue to do. Like it's almost like we think that we're like robots in a way, right? And then we're just like, we're
yeah,
just gonna keep doing the same thing day after day, keep adding things on and to keep smiling. It's like kind
yeah,
of crazy if you think about it, you know?
yeah. No, I agree. Absolutely. I know you're interested in that. And what are some ways that healthcare providers um, can regulate their nervous system? And I'm very excited to learn about that, but because I don't think I do a good job in doing that,
Mm.
especially in high
Hmm.
stress situations. So I also work in the hospital, and it's almost always high stress. I don't work in a clinic setting.
Yeah,
So yeah, give us some good tips on that.
sure, sure. So I think like to start out, like if you're kind of new to nervous system work, and regulation,
Yes.
getting kind of refresher on your own nervous system or the nervous system, I should say, and how it relates to, actual life, not like the textbooks is a good place to
Yeah.
start. And then really
Okay.
getting to know your own nervous system because we all have patterns that we tend to be like become our default. And I would say we all are like familiar. We remember learning about like the fight or flight system, right? And then
Yes.
that's in nervous system regulation work and everything, that's like sympathetic, which that translates. We know that. And most
Yeah.
of us are kind of, I would say that's kind of the majority of healthcare workers are stuck more in that yellow zone, that activation, kind of being on, always feeling like, you're on go, you're on like, let's do things, let's get things accomplished, right? Um,
Yeah.
and then we have other nervous system states, though, that become more of our default over time with a lot of practices and intention. So, like
Okay.
most of us would agree that we would rather be in a state, right, where our mind and our body feel not necessarily like calm and like meditating or anything, but just in a place where we feel very centered, grounded, confident, calm, like we can respond to what we need to, but then we're kind of able to be in a state where we can meet the demand and then we can come back to like a neutral zone, right? Where we have access to problem solving and thinking and that we don't kind of have that mental narrative going of like, I have to go, I have to go, I have to get all these things done. I can't slow down, you know? And then when we do stay in that yellow zone for so long, where we're constantly on the go, we feel very rushed and overwhelmed, then we can slip into kind of a red zone, which is where we're kind of shut down and disconnected, right? It's like we've been pushing ourselves too hard for too long. And it can happen like in the course of a day where you feel like you're go, go, go. And all of a sudden you feel like, you don't have any, like, you really don't care, you know, you're just kind of like exhausted. You kind of just want to like do nothing. And those are kind of the three main systems that our nervous system is in throughout the course of a day. And when we kind of learn what each of those states looks like for our own bodies and our own minds, we're more familiar with them, then we can start to be curious, I would say, about them and, start to, take note of which state we're in most of the time, right? And find little tiny ways to help ourselves to shift into, like, when we are in a red zone or a yellow zone, different practices that can kind of bring us back into our bodies, back into like being aware of what's going on in our minds and our bodies, and help us to shift from that overwhelmed, activated state or that kind of shut down, disconnected state back into a place where we're in the green zone again, you know, where we're like feel grounded, calm, confident, and kind of connected to what's going on in the here and the now, like being in the present. And so that's kind of a large explanation for all the different states. And I think what's helpful and what I work a lot with like myself and my clients on is like how to figure out, like, from a menu of options, right? We all kind of gravitate toward different little practices that really feel good to us. Like they feel natural. We feel like we're able to do them. They're reasonable to do within the course of our day. And also that we're able to, when we do them, like whether it's, you know, a mindful breathing or like a kind of sensory spotting, you know, looking around and like kind of noticing all the things that are a certain color. It's like a really simple thing. It sounds like over simple, but it really does help you kind of get back to here and now. But when we're able to kind of find out those practices that are really, really helpful for us, like when we do them, we notice the benefit. And we're like, oh, I really do feel like, ooh, I can exhale, you know, then we can incorporate those throughout our day, kind of sprinkle them in throughout the day so that when we're noticing we're getting more overwhelmed or we're feeling kind of like tapped out, we can be like, oh, notice, okay, what can I do now to kind of help myself get back to that green zone, you know? And when we practice it, it's like anything, when we practice it and do it and it comes more of like a natural thing for us, then we're eventually able to experience the benefits, I would say, and be like, find ourselves more in a green zone than we are in like constantly like yellow or red, which I think, you know, most of us just kind of live there because that's what happens when we work in the medical system and we're in a high stress environment all the time, you know, it's normal.
Very cool and interesting. You kind of alluded to it a little bit, but can you tell me like a practical real-time example of what you would do? So you kind of told a little bit about, you know, the sensory, but just one activity or exercise that you would do, for example, maybe if after a really stressful event or if I'm getting anxious heading into a patient room or some sort of that anxiety, what would I do?
Yeah. So I love like grounding practices of like, you know, really just like feeling your feet on the ground and then looking around, like doing a visual scan because we get kind of tunnel vision when we're really stressed about something and we're anxious, you know? So like doing a visual scan, looking up from our paper or our phone or our computer and like looking around and just like noticing what you see, naming the objects. Like literally it's so simple, but it helps de-escalate your brain, right? And so, yeah, like notice sensory things around you. Like what can you hear?
Okay.
What can you smell? If you are able to kind of focus on your breathing and just do, kind of notice if your breath is in your chest or your breath is in your belly, just notice without judging it. Like, oh, interesting. My breath is in my chest, right? And it's kind of
Yeah.
rapid. And even bringing attention to your breath helps you to regulate a little bit. And then if you're able to do that, you can also focus on, counting your breathing. Like you can count, inhale for 4, you can exhale for 8. And if you do that 2 or 3 times, like no one notices that you're doing that, right?
Yeah.
And it will help you to access that green zone pretty even with just like
Yeah.
those extended exhales, and those grounding and that kind of visual scanning. Those are things that are really, really easy to do, even when you're in a hospital or in a clinic.
Yeah, very nice. I think, yeah, I've done those before, kind of bringing your attention to the moment and, like the physical aspect of it. Sometimes I'll touch the doorknob and try to feel it, when I'm going to the room,
Hmm.
just feel how the doorknob feels like.
Right.
Uh, and that kind of helps ground me just a little bit when I go in
Yes.
there. So just for a second.
Yes.
Yeah.
I'll tell you a couple other ones. So like physically, like if you touch your arms, kind of like contain your arms this way, it's called havening. And it's
Okay.
essentially just like sensory feedback, right? And you can do it anywhere
Yeah.
on your body, but it's kind of like giving yourself that like proprioception, that feedback of like a
Yeah.
hug, essentially, right?
Hug. Yeah. Yeah.
That
Okay.
you're doing for yourself. And then our vagus nerve, which is like activates the parasympathetic, it runs very
Okay.
superficially in our ear, near our ear. So I sometimes will do like a little ear tug or just a very light
Okay.
like massage inside like the
Yeah.
canal of your ear, not the in, but like the circles around. Um,
Yeah.
and that's a really good drill for me because I will notice myself if I do that for a few like seconds, I will like yawn spontaneously, which is just an indicator that like you're relaxing, right? Your
Yeah.
body's like getting that feedback.
Oh, that's
Um,
awesome. Yeah.
yeah.
Yeah. Very nice. That was really helpful. Yeah, I think it's something that we know about and we probably listen, but yeah, I think you have to practice it really every
Hmm.
day
Hmm.
um, to kind of bring it some effect. And also, my therapist told me, you got to do it every day before you get stressed. So you got to center your
Yes.
body
Yes.
and not wait for the exact stressful moment and just do some of those activities every day. Um,
Exactly. Yep. Yep. That I've learned that as well from my teachers, and I would say like they say practice those things ahead of time so you can like
yeah,
know what you're doing, and then in real
yeah,
time when you need it, right? You're like, oh, I know what to do. I've done this before, and actually, I really like need some help right now. Um.
yeah.
Yeah. Absolutely. Absolutely.
Uh, Switching gears to a little bit, we're talking about time management, and it was interesting what you talked about earlier. I think we talked off camera, but what is energetic time management? I don't know much about it, so I'd be curious to learn. And how can it
Hmm.
help us in healthcare as well?
Sure, sure. So it's a concept I learned from another one of my teachers, coaches a while back, but I definitely have found it to be extremely beneficial for me. And it's
Yeah,
essentially like looking at the fact that our energy as a human, it like ebbs and flows, not just throughout the day, but kind of like different times for us, like hormonally, right?
good.
For women. We have weeks where we have a lot more energy, weeks where we're like pretty sedentary, or at least it takes a lot more to do the same things for us. We just like notice that we get drained more easily.
Sure.
And so a lot of it is kind of, again, noticing your own patterns, right? Times of the
Huh.
day you seem to have more energy, and then times where you seem to be more lethargic. And
Yeah.
then, and using that to help you guide if you are able to like make, some, I want to say boring, but kind of like easier tasks that take a little bit less mind power, right?
Okay.
And kind of putting those in times where you know that you're
Yeah.
typically kind of sluggish. So maybe after a lunch or whatnot, and then trying to do like the work that takes the most energy out of you and kind of correlate that to the time of day where you actually tend to have the most natural energy, right? Where you don't
Huh.
have to like chug a cup of coffee and do it, right? You're like you
Right.
naturally have more energy. Um,
Yeah.
and and that's, I mean, that's kind of like the basic of just noticing your energy and then pairing that up with things that you need to do that are on your list.
Yeah.
And then I would say that it also is like figuring out activities for you that tend to be more energizing. So, like, it might be, getting fresh air, taking a brisk walk, things like that. And when you kind of know, yeah, that usually does make me feel more energized when I do that, like taking that knowledge and putting it into your day again at times where you might need a little boost. So it's like kind of being intentional with those things that you know are likely to bring you a little more energy and like doing them in real time again so that you're kind of working with your natural energy ebbs and flows, if that makes sense.
Yeah. And sometimes I'm assuming when you talk about, taking time off from your low energy time, it may be hard, like in healthcare, when you're always
Mm-hmm.
supposed to be
Doing.
on the go. And I think the adrenaline
Yes.
somewhat gives you the energy, because you're always on this
Mm-hmm.
adrenaline rush.
Yes.
And then maybe your energy just crashes when you get
Right.
home from your
Right.
work day. Do you use
Yes.
it though then practically? How do you use that? This time management skill?
Yeah. No, I totally use it. I think, I honestly think it's like pretty integrated into my life now when I manage like my schedule at the beginning of the week. I will um I will look at, the things I have going on and kind of the appointments, the work schedule, the kids stuff. And I am in a habit now where I'm able to like
Yeah.
know what I need personally for myself to like what self-care
Yeah.
activities I need and I will like put those in um very, very first. So like obviously the things you have to be at, you put in your schedule, but then when I plan out in my planner, like I'm gonna need a little yoga here. I'm gonna need a little time to read and decompress here. Like I will pencil those things in and I'm pretty I don't know, I like to I've noticed the benefit of doing them, right, over
Okay.
time. So it's like I will make them a priority because I know that they're going to pay me back later, like when I need them, right?
Yeah.
And if I do them, then I will have kind of the ripple effect of that later when I
Yeah.
maybe am doing something I don't want to do as much.
Yeah. That makes sense. Somebody, who's already kind of feeling burnt out, tapped out, they've lived this life of stress.
Mm-hmm.
What are some steps you would say somebody can do to start rebuilding their energy or well-being? Because sometimes, when you're in that abyss, you
Mm-hmm.
don't really want to even work on time management. Everything feels so
Totally.
hard.
It's
So
so
what would you
hard.
say? Yeah.
Yes, yes. I would say like have the belief or try to access the belief that better is possible. That's really, really important. Like, even if you can't feel it for yourself, right? Just know that like others have done it, others are doing it. It's possible for you too. Even if you're like, I don't see the roadmap, I don't see how it's possible. Try to know that it is potentially true, right?
Yeah.
Because otherwise it's like, why would you even want to start on any of it, right? Like it's just
Right.
forever going to be terrible.
Yeah.
Um, and then I think like even practicing like very, very small steps for yourself to, like, for example, maybe there's one thing that comes up in that course of your week that you can just say, not an automatic yes to, but maybe you can say, let me get back to you, right? Or I will check with the schedule. I'll check in and see. Like just so it's not an automatic yes,
Yeah.
that is very helpful because it gives you like space to potentially be able
Sure.
to see if you have the bandwidth for it. And if it's something that is, not required, like I would almost guarantee that you probably don't have the bandwidth for it, right? And so
Yeah. Yeah.
just like
Yeah.
being able to have that tiny little space for yourself of being like, no, like I don't
Yeah.
have time to do that and being able to decline something. I think it's kind of empowering. I would say also, even if you're like, I have 0 minutes to do anything for myself, right? Like it's not possible to do something, that would be fun for me or enjoyable for me. Even if you can give yourself permission to do something for like 5 minutes, two
Okay.
minutes, right? Whatever is potentially possible for you. I think even if it's like listening to like a fun song that you love, or just like something that's a little bit like lighthearted, right? For you,
Yeah.
like watching funny clips, listening to a fun song, dancing it out, like
Yes.
something that just shifts your energy ever so slightly.
Yeah.
Um, in very, very small amounts, it helps you because not only it helps you in that moment a little bit, but it also like, I think it kind of like serves as a good reminder. Like doing something like that for myself didn't take long. It felt good and
Yeah.
it helped me be able to like, you know, maybe get back to finishing my notes or whatever you needed to do. Right.
Yeah.
So I just think like when you're feeling really in that space, something super, super small, is a good way to kind of get started and have just a tiny bit of momentum. The last thing I would say for that is like, if you are just able to write down like on a piece of paper for 5 minutes, right? Like write out all the things that are kind of causing you the most stress, being really clear about them and kind of getting them all out without feeling like you need to edit them or like no one else is going to look at them. You know what I mean?
Yeah.
Just like see if you can come up with the things that are naming those things for yourself. I think it's powerful. Um, and then like a bonus would be if you could write down things that, um, energize you or that you really want. So a lot of times we're like, we really hate what we're in or we hate our job or we're really miserable at X, Y, or
Yeah.
Z, you know, like
Yeah.
write down a few things, a quick list of things that would be like really amazing to have. Because it helps your brain like create and see possibilities, right?
Yeah.
Even if you don't know how to get to them at any clear point, like with the right support and time and strategy, like you
Yeah.
could probably get some of those things. And that's kind of encouraging to you as well, I think, to be like clear and honest with yourself, you know, about what you don't like and what would be amazing.
Yeah. Those are some great tips. And I think saying no is so important. I've started saying a lot of no's.
Yay.
Yeah. Yeah, I do. And it helps a lot because, and I think for some people it's harder because they really want to do those things and, maybe they don't
Hmm.
find the time. But really, it helped if I started doing the things that I really just wanted to do and not saying any
Hmm.
empty no's. And I think it
Yes,
helped
it
a
does.
great deal. Yeah,
It
it
does.
did. Is it the tips that you gave if someone is really um, frustrated in their job or in medicine per
Hmm.
se in the field? Do you think if you make these small steps, it is possible to get joy back into it?
Hmm.
Or would it be a lost cause or maybe time to quit, something like that? Or is it possible to get
Oh,
joy back? Yeah.
yeah, no, I absolutely think it's possible to get joy back. I think like a lot of times we have to reconnect with like the reasons that we went into medicine, right?
Yeah.
And like find ways that we can bring more of those aspects into our day to day. And then if there's things that we can even release some of like the expectations of that are causing us a lot of stress, right? Even if we can like delegate some things, if we can take some things off of our plate, or even if it's stuff like we have to do, but we don't enjoy it, like for most of us, like documenting and that kind of stuff. It's like, how can I do this differently so that it's not quite as much of a drain on me, right? So I work with a lot of people on just like how to not just be more efficient with documentation, but how to like release this mental story that we have that it needs to like look a certain way that's taking up more time than it needs to. Like, how can we do like B minus notes, right? It doesn't have to be perfect. Like, how do we get the essence of what's needed and move on? Like, we don't need so much mental drama about some of that
Yeah.
stuff. Um, and even if, yeah,
Yeah.
we can just like find ways where we don't have to have it take so much time on certain areas, or if we could just do things differently and bring more like lightheartedness into them, I think that we can slowly rebuild, the day to day feelings and like shift some of that dread and like heaviness into more like even just like neutrality, I think is a positive, right?
Yeah.
And then hopefully also like sprinkle in more joy and like connection and purpose I think that
Yeah.
that's possible for sure.
It is. Yeah. Perfect. Yeah. And I like it. B minus note.
Yes. Yes.
I love that. Yeah. I think, I know you work with a lot of women and women are, perfectionists in that sense too, and they
Hmm.
want to write the perfect notes and do the perfect
Yes.
job. Yes.
Like the ones
So
you wrote as a medical student and you were graded on. Like, you don't have to do it that way anymore. You don't have to write the six super long HPs. Like, it doesn't
yeah,
have to be like, yeah.
it doesn't have to be that way. Perfect. I'm
Hmm.
curious to know what are some of the things that you do on the go daily for yourself? And do you feel like, your journey from burnout to here, like, do you think you feel different now?
Hmm.
And you made a huge impact on your life, or it's something that you have to work on daily still?
I mean, I would say yes, it is, but it doesn't feel like work as much now. Like
Okay.
it's definitely intentional living, I would say.
Yeah. Yeah.
Because if we just return to like autopilot, I feel like I might slip back into the patterns I used to have that created the burnout. But like the habits and the like small things that I do that are just kind of like part of how I do life now, they don't
Yeah.
feel hard or burdensome. They just feel like the things I know to do to feel
Yeah.
good in my life
Yeah.
and in my work.
Yeah.
And I don't know, me personally, I love like movement in some way, yoga, stretching, like outdoor time, connection with others. Like
Yeah.
even, I love connecting with my colleagues. It brings me a lot of joy. So I like to do a lot of like little check-ins or little like coffee walks. And I just like grab people. We go outside for like 10 minutes over lunch and get fresh air and like talk about something that's not medicine, and just like
Yeah.
that brings a lot of joy back into my life. And then, yeah, like people oftentimes ask me, like, how do I, be a doctor and a mom, a four, and that kind of stuff. And it's like I delegate a lot of stuff. I outsource a lot of stuff.
Yeah.
Um, and that's been a journey for me too. But it was like, once I kind of was able to realize that some of the stuff doesn't need to be done by me, but just needs to get done.
Yeah.
But it doesn't bring me joy. Like, of course, there's a balance for everyone, like money and those things are all like into
Yes.
play.
Yeah.
Um,
Yes.
but I think like small baby steps in those things has allowed me so much more freedom, right? To really truly be doing the things that I want to do and like the things I need to do, or that need done. I can use a combination of like delegating them to others, outsourcing them, like paying others to do certain things for me at home for
Yeah.
sure. And that just like creates the time for me to like have that short little couple hours with my kids and my family that I can actually just like hang out with them and not be like, I have to clean the kitchen. I have to do this and that,
Yes.
because it's otherwise I found it to just be too stressful and like not very sustainable for me. So yeah,
Yeah.
definitely in a much, much better place than I was a few years ago.
Good. That's awesome. Yeah, that's good to know. And how do you not bring that stress home? I'm just curious. So when you come from
Hmm.
work, any tips regarding that? So if you're at work, and a lot of us bring
Hmm.
it home, like the
Hmm.
mindset, and that helps us be fully present in the moment for our families or for
Right.
ourselves. How do
Right.
you work with that?
Yeah, yeah, I think it's practice too. Awareness is important. I like to do some kind of little like transition type ritual on my way home. So in the car, I will listen to like I have a little 10-minute guided meditation thing saved, that I've listened to like probably 3 times a week at least.
Yeah.
It's on an app called Insight Timer. It's amazing. I use it all the time for lots of things, sleep and
Yeah.
otherwise.
Yeah.
Um, but it is just about, it's like helps me get into that headspace of like kind of helping myself draw that boundary between like work, like processing, not to like stuff down those things that happen, but just be like, okay, I'm like closing the box of work right now, right? I'm like noticing what came up for me, what's still stressful for me, making a plan if I need to, of like when am I going to finish the thing I need to, or how am I going like kind of noticing I might need to process this really difficult case with my colleagues tomorrow. But
Yeah.
just like instead of having it all swirling in my brain, it just like helps me to kind of make that transition, right? So that I'm like,
Yeah.
okay, I'm acknowledging everything that happened, all the stressors, and now I am turning my attention forward, the
Yeah.
people, and kind of like consciously knowing I want to be with them for these couple hours. Yeah, processing some of the emotion and being able to then be able to be present with them has been hugely helpful for me. And then, no, I'm not perfect at it, right? Like definitely some stuff kind of residual can come into that if it's been like especially a stressful day. but just like
Yeah.
even giving myself grace for that. And if I had like, I don't know, something planned that seems too stressful at that point, and I'm just
Yeah.
like, yeah, we're just gonna like make a really easy dinner and we're just gonna hang out and like watch something together that's funny and lighthearted, it's helpful instead of like, I don't know, gripping my plan that we had to have it look a certain way. And, it's just like being able to be more flexible with it, I guess is what I'm trying to say. That helps me a lot to not feel so stressed and have this like perfect vision of how it has to go. Has been really helpful for me.
Yeah, no, that's awesome. That's really cool. I like the transitional ritual that you talked about. That's very helpful. I think we're going towards our end. I want to say any final words of, encouragement for those who are struggling with any sort of stress, guilt, work-life balance. I'm sure there are lots of
Yeah.
people out there struggling with
Yeah.
many of those. Yes.
Yes. Yes. I would just say, like you're definitely not alone, right? I think if you feel like you are alone, just know that even if people don't talk about it, that they are likely struggling with very similar things to you.
Yeah.
Um, and I think talking to one another is really, really powerful. Not like you have to share your whole heart and soul with them, but even just
Yeah.
telling them something that you're struggling with, that vulnerability, I think can open up a pretty powerful line of like connection. And even if it's sharing tips and tricks or it's like mentorship or any of that, I think is super, super helpful. And then I also just think that like for me, I wish I would have sought support more quickly for myself. I kind of struggled alone for a long time,
Yeah.
trying to kind of like piece together things for myself
Yeah.
and thinking like I should be able to figure this out.
Yeah.
And I think the truth is like you probably can, but also like I don't know, you don't deserve to struggle that long, I would say,
Yeah. Yeah.
and feeling better is possible. And like, you deserve that. You don't have to suffer. That sounds kind of dramatic, but you don't have to suffer for years in silence, right? And just kind of think that it is what it is. Like, you really do deserve to live and work in a way that feels good and like meaningful to you. And if you are struggling with that, like not only are you not alone, but like there's a lot of avenues of help for you. And I just encourage people so much to seek those out and try things out because yeah, better is possible. And like, I hate to say this, but I don't think that like your employer is probably going to be the one that like comes and saves you, right? Or,
Yeah. Yeah.
or your partner. So it's like, there's a lot of amazing people out there in communities. And I just think like, being brave and seeking those out for yourself is something that you deserve and something that will help you to thrive.
Yeah, that was awesome. Thank you so much,
Thank
Sarah,
you.
for doing this with me today. I have a little tradition that I read a small poem at the end
I love
of the
it.
podcast. So I'll do that and then we'll end this. So
Awesome.
it's called The Guest House and it's by Rumi. This being human is a guest house. Every morning, a new arrival, a joy, a depression, a meanness. Some momentary awareness comes as an unexpected visitor. Welcome and entertain them all, even if they're a crowd of sorrows, who violently sweep your house empty of its furniture. Still treat each guest honorably. He may be clearing you out for some new delight. The dark thought, the shame, the malice. Meet them at the door laughing and invite them in. Be grateful for whoever comes, because each has been set as a guide from beyond.
That's
Thank
beautiful.
you. Thank you so much for doing this with us today.
Thank you so much. It's been so fun.